Hello, I'm Jesse Bell, and I'm back for the second part of this lecture. Um, I'm the Claire M. Hubbard Professor of Health and Environment at the University of Nebraska Medical Center. And this lecture, I'm going to be talking about the impacts of climate change on health. So just to break it down again, right at the beginning, I'm going to first talk about climate and health. Then I'm going to talk about climate change and health. Then I'm going to talk about the role that public health potentially plays in all this, followed up with future work and then some closing thoughts. So, climate and health. One of the things I want you to know is that we've known about the relationship between climate and human health for centuries. There's a long history here. Hippocrates wrote about epidemics back in 400 BC and noted that changes in weather, changes in climate, they would see certain outbreaks of certain diseases, certain epidemics. He obviously didn't understand all those relationships, but he understood there was a pattern there. Then you fast forward to 1814. Obviously, there was a lot that happened between there, but there's just a couple of highlights. Dr. Tilton was a Surgeon General for the U.S. Army, and he directed all hospital surgeons to keep weather records because he knew, or he understood, that with a change in precipitation and temperature, they saw a change in troop health and diseases that started arising in some of the soldiers that they were working on, which actually they were most interested in was trying to understand the relationship between that with malaria. So fast forward to today, we understand that climate has a variety of different ways that it impacts our health, both directly and indirectly. By direct impacts, I'm talking about the things that directly influence you or affect you in some way. So extreme heat, air pollution, extreme weather events, those things have direct impacts on you and your system and the environment around you and the communities around you. Then you have the direct impacts. These are, sometimes a little bit harder to see, sometimes a little, the understanding of those systems are a little bit more complex. But the indirect impacts also have potential health impacts on you as well. But that's a change in the environment or a change in the society around you in some way that's being influenced by climate and weather. And then those things have a direct impact on your health. And I'll talk about those in a little bit more detail in a bit. So over the last century, we've known that droughts have likely killed more people than any other extreme weather or climate-related hazard, with floods being a close second. And with drought, it is likely that many of the deaths are associated with malnutrition and famine, whereas with floods, many of the deaths are obviously associated with drowning and the flooding itself. In the United States, it's a little bit different. So this time period from 2004 to 2013, heat waves likely killed more people than any other extreme climate or weather-related hazard, with tornadoes and hurricanes coming in a close second and third. But not only do these disasters, these climate-related disasters, cause human health outcomes, they also cause societal issues as well and economic loss. So during this period from 2004 to 2013, there was almost $400 billion of economic loss from hurricanes and nearly $80 billion lost from heat waves and droughts, which plays right into this, which we're talking about the 2017 season, which was one of the costliest extreme event season in the history of the United States. So we had $16 billion weather and climate related disasters. And these are disasters that exceeded $1 billion of economic loss that happened all across the United States. So with those 16 disasters, if you brought them all together, it equaled $306 billion of economic loss, at least $306 billion of economic loss, and a little over 3,000 deaths associated with these disasters, with many of those deaths coming from Hurricane Maria down in Puerto Rico that happened September of 2017. So that's just to illustrate some of the ways that climate impacts your health. Now it's already impacting your health in some way. Now I want to talk about climate change and how climate change potentially impacts your health. So the US GCRP, or the Global Change Research Program, released a report that came out from the White House in 2016, and it was on the impacts of climate change on human health in the United States, a scientific assessment. I was one of the lead authors on this report, and basically it was report was trying to understand the impacts of climate change on human health. And so it brought together experts from throughout the federal government and academia and other institutions as well to come together and try to understand what are some of the impacts of climate change on health, and try to bring that together in one report, and synthesize what are the potential impacts. This was a pretty big endeavor, as you can imagine. It brought together a number of individuals, everything from medical doctors to people that work for NASA, NOAA, CDC, basically the whole gamut. And so there was a variety of different findings that came from this report, but I'm going to illustrate two here that I think are very important. And there were two of the first findings that came from the report, which was that climate change is a significant threat to the health of the American people. And as you can remember from my last lecture, I talked about all the different ways that the climate is changing across the United States. Not only that, it's changing across the globe as well. Well, all those changes in our climate is having impacts on human health, and it will continue to have impacts on human health into the future. So not only that, every American is vulnerable to the health impacts associated with climate change. And so that goes again to all the ways that we know that the United States is changing, and all the different ways that we're experiencing extreme events and increases in temperature and changes in precipitation across the United States. All of those things have a potential impact on human health. Now, I want to illustrate that even though that every American is vulnerable to the health impacts associated with climate change, obviously some Americans are more vulnerable. So typically it's the young, the very old, and those with the fewest resources. Those are the ones that are more vulnerable to the potential health impacts associated with climate change. So this is just kind of illustrating some of the ways that climate and climate change potentially impacts human health. So what we have here, that central wheel that's spinning, is rising temperatures, more extreme weather, sea level rise, increasing CO2 levels. All of those things impact the environment or impact the world around us in some capacity. And that exposure, that change in the exposure pathway, then leads to human health outcomes. So that second circle is the exposure pathway, and then the outer part is the potential human health outcomes that comes from those changes in the climate system itself. So this is just another way to look at that. So up at the top, you have the climate drivers. So again, that's increases in temperature, changes in precipitation, extreme weather events, sea level rise, all these things. That influences the exposure pathway in some way. Extreme heat, poor air quality, reduced food and water quality, infectious disease, all these things. Then that is what actually gets us to the health outcome. And there's a variety of different health outcomes. There's a few examples here. So that's the pathway from the climate drivers down to the health outcomes. Well, as you notice, there's two gray boxes on the outside. So you have the social and behavioral context and the environmental and institutional context. Those things can either increase the number of health outcomes or potentially decrease the number of health outcomes. And by social and behavioral context, so here I'm talking about age, gender, race, ethnicity, poverty, housing, infrastructure, education, on down the line. Environmental institutional context, we're talking about land use change, ecosystem change, infrastructure condition, geology, geography, agricultural production, all these other factors. So those things can be influenced to either reduce or increase the number of health outcomes that we experience with some of these climate drivers. And again, this kind of goes back to, what I was talking about before. All Americans are vulnerable to the health impacts associated with climate change, but some Americans are more vulnerable. And I could say the exact same thing internationally as well. And that's due to the context here: social and behavioral, institutional, and environmental. So this is just another way of potentially looking at this. So this is populations of concern, how we get to some of those. So, we have, again, that pathway, and this is just another way of looking at it. So we have climate drivers, exposure pathway, health impacts, and health outcomes. So you have the exposures. So poverty, occupation, racial discrimination. What does your community actually look like? Who are the people that are living there? Then you have the sensitivity. Is there underlying health disparities that occur? Then you have the adaptive capacity. So what's the poverty, education, social norms, governance? What are those factors around the community that can either increase or decrease those potential health outcomes? So this is just another way of seeing how changes in the community, changes in the population structure, demographics could potentially impact health outcomes, going from the climate drivers all the way down. So that was just a little bit of a background. Now I want to jump forward and talk about the ways that the climate is changing and what that potentially means in context of human health. So we know that, we've been seeing changes in extreme heat events, increases in temperature, higher humidity, longer, more frequent heat waves. These are things that we're already seeing, and we project to change and continue into the future. Over here on the right side of the screen, you'll see some work that I've worked on looking at changes in heat waves over the last 50 years. Heat waves and heat has a direct impact on human health. It can cause heat stroke, dehydration, and heat-related illness. And again, like I was saying before, there's certain populations that are more vulnerable to these exposures. So outdoor workers, student athletes, people in cities, people without air conditioning, sometimes people with chronic diseases. These are the ones that are potentially more vulnerable to the health impacts associated with changes in extreme heat. Air pollution is the next factor that is influenced by changes in climate. We've seen increases in wildfires, smog, pollen, mold. All these things have been changing over time, along with our changing climate. Will likely change into the future. All of them have direct impacts on human health in some capacity, potential asthma, respiratory issues, allergy issues. And then you have, the vulnerable populations that are associated with that. So people with heart, respiratory issues, conditions, people with asthma, chronic lung disease, things like that. So this is just illustrating one of the ways that our air quality is changing and has changed. So this is from a study that was done looking at ragweed pollen season. And what they found was that over last, I think it was around 20 years, they've actually seen an increase in the ragweed pollen season in the United States. And as you can see there, around Omaha, we've seen an increase about 10.6 days in ragweed season. Whereas if further you get north, where we're seeing more warming, you actually see almost 30 days of increased ragweed season. And some of us, we think about it in context of allergies, and it seems like it would be a nuisance or an annoyance. But those of us that have asthma, this change in pollen season could potentially be life-threatening. Extreme weather events, as I've illustrated before in my previous lecture, we've been seeing a change in extreme weather events. We've seen increased frequency and intensity of heavy downpours, floods, droughts, and other major storms. When these storms happen, they can cause injury, illness, displacement, and even death. And the vulnerable populations that are associated with these potential health impacts are anybody that's in the pathway of these storms, and especially those that don't have the resources, don't have the ability to get out of the pathway of the storm. Those are the ones that are most vulnerable. And again, going back to it, we've seen an increase in the fire season since the 1970s in the United States of at least 78 days. We've also seen that the fire themselves have been lasting longer and more significant. And moving forward, we project that fire season is going to continue to become larger, and that we'll likely see an increase in the number of weeks where we can have these very large, intense fires over the next century. And as you know, when these wildfires happen, the impacts are immediate in the area where they occur, but also they have potential to impact people thousands, hundreds of miles away, because the smoke doesn't stay right where the fire is, and it has the potential of moving across large areas. And so what we're seeing here is wildfires that occurred in 2017 or 2018 in the United States, and we see the smoke moving across the central and northeastern part of the U.S. that come from wildfires that were happening in the western part of the United States. We also have seen an increase in billion-dollar disasters over the last 38 to 40 years. And this is from a variety of different factors that's causing this increase in billion-dollar disasters. One, we've been seeing more of these types of events, the increase in intensity and frequency of these events. But we've also seen increases in population, increases in building and construction in certain areas, especially along our coastal regions, which are more susceptible to some of these impacts. Diseases, insects, ticks, rodents, they're all directly tied to the environment, the climate, the weather that they experience on a regular basis. So with higher temperatures, changes in precipitation, disruption of ecosystems, we've been seeing changes in certain diseases and certain pathogens that are transmitted by some of these different vectors. So vulnerable populations are typically people who spend more time outside and have the potential to be impacted in some way by these organisms. So we've been seeing an increase in the occurrence of Lyme disease. It's been occurring earlier in the year, and we project that moving forward that the occurrence of Lyme disease will actually continue to happen earlier and earlier in the year with future climate change as well. So there's more potential for exposure to the tick that carries Lyme disease, which can cause the potential transmission of that particular disease to us. So here's just one example of showing some of the changes that we've seen in Lyme disease across the United States from 1996 to 2016. And what you'll notice here is that the disease has been spreading outward, and we've been seeing it more in areas that it didn't occur before. But also, I want you to notice that we're starting to see cases starting to move into regions that never experienced this disease before. And Nebraska is obviously, it's getting closer and closer to occurring here. And a lot of that change, or some of that change, has been shown to be associated with changes in temperature and changes in precipitation patterns that have occurred over that time period. There's also potential for increased contamination of food and water, higher water temperatures, heavier downpours, changes in sea level. All these things, extreme events, all have the potential of impacting our food supply and our water supplies in some capacity. And that can cause intestinal illness, toxins in swimming areas like algal blooms, and even decrease in drinking water availability. And the populations that are most susceptible to this are children, elderly, people with weakened immune systems, people in low income areas, and anyone that doesn't have adequate access to fresh water. So here is just a illustration of that, or one of the illustrations of that. So what we're seeing here is a relationship between changes in ocean temperatures and Vibrio pathogen. And so Vibrio is a bacterial pathogen. Vibrio vulnificus, so there's Vibrio cholera, which causes cholera, but there's Vibrio vulnificus, which is in our coastal waters around the United States. And it can cause, it can get into oysters. So if you eat oysters and you get really sick, it might be caused by Vibrio vulnificus. Also, Vibrio vulnificus, if you have a lesion of some sort and you're in saltwater, coastal waters, and you get an infection caused by Vibrio, it can cause a flesh-eating bacteria. So it's a pretty nasty pathogen to potentially pick up. And this particular pathogen only grows or does well when temperatures, ocean temperatures, are above 15 degrees Celsius. And what we're seeing here is any of the red is indication of when ocean temperatures would be above 15 degrees Celsius in August, which then could potentially be susceptible habitat for Vibrio growth and development. And as you'll notice, with increases in temperature under different emission scenarios, we actually see an increase in potential habitat for Vibrio to grow and exist up in Alaska, which is where we get a lot of oysters. There's also the threats of hunger and malnutrition. These aren't typically as big of problems in the United States, although we do face these problems in the United States. Internationally, this is definitely of major concern, and that's caused by increasing temperatures, changes in humidity, extreme weather events like drought, potentially causes disruption of crops and agricultural systems, which then can lead to undernourishment and vitamin deficiencies, malnutrition, things like that. And then the vulnerable populations are typically the very young, pregnant women, older adults, and communities that don't have as many resources. And from this, and from some of these things that we're talking about, there's a potential for human health outcomes, or mental health outcomes, and behavioral health outcomes associated with some of these changes as well. And that's especially around those extreme weather events. You think about a community that's been hit by a major hurricane or a major drought, and you've lost your house, you maybe lost family members, maybe you lost your job because of this. That could potentially lead to stress, depression, anxiety, PTSD, suicidal thoughts. And again, there's a variety of different populations that are more vulnerable to these potential impacts. And again, a lot of times you can easily visualize these potential impacts based off of hurricanes or some of these major events that have come in and just destroy communities. But in the same context, droughts, they have the same ability to destroy livelihood. Major drought comes in, especially in rural agricultural regions, they have the potential of wiping out the ag industry or hurting the ag industry in some capacity, and that impact could potentially cause mental health and outcomes. Then you have the displacement and potential conflict that comes from displacement. Again, a lot of this is driven by extreme weather events, and it can cause Again, some of those mental and behavioral health issues that you see before. And then again, the same populations are the ones that are in the pathway of that storm. There's a variety of different examples that can be put up here. I'm going to talk about the Syrian conflict because it's very much in the news, and I think people understand it and people have talked about it quite a bit. It's estimated that over 400,000 people have been killed during this particular conflict, and that over 5.5 million refugees have fled Syria during this particular conflict. One of the things that I want to illustrate here is that, there was a major drought that happened in Syria before the conflict occurred. Now, the drought definitely caused economic harm and damage to that country. And the drought did not directly cause that conflict. It was a response of the governments and the people that led to the potential conflict. But you can imagine the scenario. So, again, you have communities, rural communities, agricultural communities. You have this major drought that hit. Those people living in those agricultural-based communities, they could no longer sustain their livelihood. So they go to the cities looking for job, looking for work. You can't find work. You can't find jobs. You can't find assistance that you need. You become disenfranchised. You become upset. You start to protest. Then the government, in response, has a violent response to your protests, which then causes conflict and causes more turmoil, and things just start to bubble over and continue to expand and cause dramatic impacts from there moving forward. So that's just kind of illustrating some of those pathways. Obviously, there's a lot more complexity in there, but it just kind of illustrates the potential for causing some of these crises, which 400,000 people die. That's a public health issue. Refugees trying to find places to live and sustain. That's a public health issue in itself. Also, I want you to know that when they looked at this particular drought that hit Syria, when they could actually identify that climate change likely intensified that particular drought to be more intense and more severe than it would have been without climate change. So there's a potential direct relationship there between that particular drought and climate change. So just to kind of summarize here, there's a lot that we can do. There's a lot in the public health sector we can do. One, just educate ourselves, educate the public on the potential health threats that are associated with climate and climate change, enhance the monitoring and be able to understand what is changing and what potentially will change, research some of those potential impacts so that we understand the systems before they change so that we can get ahead of some of this stuff, and then just contribute to the dialogue that's out there. Because a lot of times people don't see climate change as a human health threat. They see it as polar bears, or they see it as somebody's problem over in Africa or something like that. They don't see it as a problem in their backyard. And I can tell you based off of the reports that have come out and the research studies that have come out, it is a problem in our backyard. So there's a lot of things that we can do and we probably should do. Also on top of it, I want you to understand that there's a variety of different public health agencies all across the United States that are already looking at this stuff. And they're trying to understand the relationships between climate change to human health, because they want to get ahead of this so that when the next major extreme weather event happens or the next major disease outbreak happens, they're prepared for it, because they know that we're in a continually changing environment, and that changing environment has the potential of causing human health consequences. So there's a lot of opportunity out there, and I hope that this opens up some ideas and some thoughts on what can potentially be done in the future. So in closing, climate change is a significant threat to the health of the American people and to everybody across the globe. All populations are vulnerable, but some populations are more vulnerable. Costs are increasing. There are multiple relationships between climate and health, and we don't understand all of them. And there's a lot of research and a lot of work that needs to be done to try to understand some of these relationships so that we can get ahead of it before it becomes the next big thing that hits the United States or hits somewhere else. And there's a lot of opportunity, and there's a lot to be gained from combining expertise from public health to climatology to engineering. Bringing all this together can help us solve some of these complex issues moving forward. So with that, thank you very much. I greatly appreciate your time, and I look forward to any questions that you might have.